GERD, G-E-R-D, stands for gastroesophageal reflux disease. It's a medical term for a common condition that afflicts millions of people worldwide called heartburn. Heartburn actually has nothing to do with the heart. Heartburn is due to reflux of acid contents from the stomach into the food pipe, the esophagus. All of us at the lower end of the food pipe have a sphincter called the lower esophageal sphincter. Its job is to stay closed, open the moment we initiate swallowing. Food then goes into the stomach and then it's supposed to close to prevent food or gastric acid contents coming upstream into the esophagus. Many of us, as we age, develop what's called an incompetent lower esophageal sphincter, so it doesn't function well. It's a valve. If it was made by General Motors, there would be a recall. We have a saying, you're only as good as your weakest sphincter. So in order to treat heartburn, it's very simple. Just think about the pathophysiology. We can take antacids like Tums or Rolaids to neutralize the acid. That does the job, but it's not as good as the next class of drugs, which are called H2 receptor blockers. And those include Zantac, Tagamet. Those are the kinds of drugs that fall into that category. And then finally, there's a class of drugs, prescription drugs, that actually shut off acid secretion. And they're extremely potent, and they're known as proton pump inhibitors. And in that category, we have drugs such as Prilosec and Nexium, prescription drugs that your doctor will give you if it is appropriate.